Is Marcy Neher-Schwengler, and I'm a registered nurse and an instructor in the Faculty of Nursing at the University of Lethbridge in Alberta. Today, I'm going to talk to you all about critical care nursing or intensive care nursing. And Callan and Richard asked me to speak, and they had some really specific questions that they wanted me to answer for all of you. So the first one is, who am I? Which I've already explained. And one of the questions was, why did I stay in critical care for so long? Well, first of all, critical care is, that's an umbrella term for both all different kinds of intensive care medicine and emergency nursing. For me specifically, I've spent my career in intensive care medicine and in cardiology. So critical care is specialized treatment given to patients experiencing a life-threatening or a potentially life-threatening illness. For me, it's always been very exciting, and it's really fed my values as a nurse as being a lifelong learner and really taking care of a patient in a real holistic way. Because typically you only have one or two patients when you work in a critical care environment. So my journey to critical care, as a new graduate nurse, I was working on a medical surgical unit in Lethbridge, and one of my patients on a night shift, of course, had a cardiac arrest. A lot of cardiac arrests happen on night shift. So my patient had cardiac arrest, and the Code Blue team arrived and basically took over the entire situation that was happening with this patient. So they took over the medical care, they took over sort of the psychological care that me and some of the other nurses needed, as well as they provided care for the family members who came in, who were called in. Now, the patient did not survive his cardiac arrest, but I will say I was so impressed with the care, the confidence, and the intelligence and the knowledge that the critical care team provided, and 2 out of 3 of them were registered nurses, that I decided that was who I wanted to be as a nurse. That was what I wanted to be. And so I started to inquire to figure out, how do I get there? How can I be there? Am I good enough to even do this work? So what I was told was that I needed to really build my foundational skills in nursing first. So that could be working on a med-surg unit, working on a pediatric unit if your goal is to get to PICU. It could be working on a cardiology unit if your goal is to get to cardiovascular ICU or a coronary care unit, or it could be a burns ICU, and then you would want to work on a medical burns unit. So there's a lot of different directions that you can go to, but typically what most managers will tell you is you need to build those foundational skills first. Now, that being said, I have heard of new grads getting hired and getting jobs in intensive care units. However, as a previous manager of an intensive care unit, I wouldn't always recommend that. I think building those foundational skills will make you a much more confident nurse, and yeah. So, but we'll talk a little bit more about that in a bit. So, for me, I started in med-surg nursing and decided to branch out. I moved to San Antonio, Texas. I took a job there on a med-surg unit, and then I stayed there for a while, and then I took a job in Tallahassee, Florida, where I also worked on another med-surg unit, and eventually decided that I wanted to come back to Canada. So I landed in Victoria, BC, on an abdominal thoracic med-surg unit, surgical unit. And I was about 5 years into doing med-surg nursing when I decided that it was time for me to start my critical care journey and start some education. So I did a 12-lead ECG course And sorry for the banging, there's renovations going on in my house right now. But I took a 12-lead ECG course in Victoria, and at that time, the nursing instructor of that course said to me that I should apply for the job in the cardiovascular ICU. And I was successful in that job. I was hired to work in the step-down unit to start, but at that time in ICUs or in critical care, each hospital took on their own training. So they had their own training program. So I had classroom education as well as bedside shifts education, which were extremely valuable. And I will never forget those mentors that I had in Victoria. It was an amazing learning environment. And so I stayed in Victoria for about 5 years and eventually made my way back to Lethbridge and was hired in the intensive care unit here in Lethbridge, Alberta, and that's I stayed in Lethbridge. I have held different positions in that time. I stayed about 12 years in the intensive care unit here, and then went to cardiology and heart failure, and worked in the angio suite for a while as well too, and then eventually went back to the ICU as the manager. I took a job as a manager, and then I stayed there for 3 years as manager of the ICU, and then now I am at in the Faculty of Nursing at the University of Lethbridge. So super long career, lots of different jobs. I've loved every single one of them, but really have a strong pull to critical care and just the education with that, which the students know. So so that was my journey through the ICU. So why did I stay there so long? Again, that was one of Richard's questions. Well, I loved it, and I found that the education that was provided to me was constant. It challenged me, and I was learning every single day. Was I having great days every single day where I thought I knew everything? Absolutely not. And that was part of the thing that I loved about it. I never felt like I wanted to be an expert, but there was just so many different conditions and so many different treatments, and such a critical care is such an ever-changing environment that I just and I really relished in that. I loved it, that it was changing all the time and that I was learning all the time. I'm not gonna lie, I do like the adrenaline part of critical care nursing. But that being said, I really love taking care of the patient holistically and only having 1 or 2 patients and taking care of the family as well. And we know that patient and family-centered care is very, very important right now. So as a manager, one of the things that I looked for in potential people that I hire, I really look at, I need them to have a love of lifelong learning. And the way that I sort of figure that out in new people that I hire is I have a, as all ICU managers do, we have a pretty rigorous training program, but we also have a very rigorous interview process. So I'll give you an example. If this is something that you're thinking about, you would like to pursue. An example of one of the questions that I ask to interviewers or people that I'm interviewing is I ask the question, can you tell me about the last journal article that you've read, medical podcast that you've listened to, or maybe medical webinar that you've watched, and was it evidence-based, and how did you apply it to your practice? And I will say, if people that are interested in critical care, they'll typically always have a really good answer for me.